Hey, everybody, it's Dr. Angela Cudger, and we are here tonight for another Legacy Wellness Tribe check-in. Now, tonight I have with me Dr. Natasha Bruley, who is also affectionately known as Chef BEEE, and we're going to have her talk a little bit about what that means. But she is not only a mathematician and college professor, she is a holistic health coach and plant-based chef. Tonight, we're going to be diving into all about what your health squad should look like. With everything that's going on, doctors, nurses, therapists are inundated with people who need help, people who need guidance. And so we're going to talk a little bit about what some of your alternatives would be and who you should have on your health squad. So I see you guys are already jumping on here. As soon as you jump on here, you know how we do. Two things. Let us know if you can hear us. Let us know if you can see us, and let us know that everything is all good. Now, I'm going to check my phone, and I'm going to make sure that everything's all good on my side as well. All right. And as soon as you hop on here, let us know that you can hear us. Let us know you can see us, and we will get right into the content of what we're sharing. Additionally, you want to take the opportunity to share this out because a lot of things are actually happening now. And so we want to make sure that you know who you can call on, who you can lean on, and the types of credentials and background they need to have so that you're getting the guidance that you know you deserve. Natasha, tell us a little bit about who you are, right? Yep. And how you became known as Chef BEEE.
Oh boy. So such an interesting journey. So as Angela mentioned, Dr. Kudjo mentioned, I am a mathematician, math educator, trained in mathematics for many, many years. I actually have my PhD in mathematics, and I'm a college professor. And maybe, now about 12 years ago, I actually had a health challenge, finishing up graduate school, new baby, just a lot of things were converging at one time. And I had to make some serious changes with my wellness. And so I've always been one of those people that's been interested and concerned about eating well, taking care of myself. Actually, I remember even my very first experience finishing graduate school the first time. I was about 23 and I had gained about 30 pounds because you're just stressed eating. Yeah. And I remember saying to myself, oh my gosh, I need to start working out now. And I need to take this seriously now. I just remember that being like just a download. This is so important to have as a lifestyle now, because if I don't do it now, it's going to be harder later on to really change. Yeah. And so I've just always been one of those people that's been mindful about what I'm eating, working out, just, into wellness. That's just, I've been like that. It's just a natural thing for me. And so after, this time with all of these things happening, stress, high blood pressure, you name it, I actually gained I was up to about 220 pounds when I had my first child. Yes, people don't know that, but yes. And, when you're that heavy, all sorts of things can start happening. Mm-hmm. And so my doctor at the time was like, look, you need to change your diet, you need to start working out. And, I was going through some emotional things as well. So I was really kind of doing harm to myself. That is doing the wrong things on purpose because I was just self-sabotaging, we get in that phase of our life as well. And I also remember the catalyst for me, one of my really good friends from college who really introduced me to yoga and some other things was diagnosed with cancer. Wow. So she's a year younger than me and was diagnosed with cancer. And I'm like, this person's always been healthy, like always doing the right things, positive, you name it. And so she didn't even know where it came from. And so I called to check in, see how she was doing, seeing what she was doing as a strategy for her wellness and to restore it. And she decided to not go the conventional route and get chemotherapy and radiation treatment and all of those things. She decided to go more holistic with the way she was going to approach this cancer diagnosis. And so with that, she decided to go to the Living Foods Institute, which is this amazing institute here in Atlanta. And she said, man, people come from all over the world. They come here to heal, to just really learn how to think differently about food and everything. And so I'm one of those people. I really like to learn. I just like to soak up as much knowledge as I can,
Mm-hmm.
be a better person. And so even though I didn't have a cancer diagnosis, I knew that I had some things that I wanted to reverse, correct, shift. And so I went myself. And really, that ignited all of this. That ignited the work that you see now that I do as Chef BEEE.
Nice.
I remember being there and saying to myself, wow, I really want to bring this to my community and I want to be the person to do it. There's so many people that I saw around me not eating well, not taking care of themselves. And I was like, man, I want to be that person that's going to help to inspire them to do something different. And so, really, Chef BEEE was born. Now, just so you know, my name is Natasha Bruley, and my last name starts with a B. So, my students, for many years, I've been in higher ed for many, many years. My students have always called me Professor B or Bruley or something, like they just called me that. And so it's morphed in many ways over the years to Professor B. All right. And when I started this work, one of my good friends, he said, man, you're not no Professor B, you Chef B. So he's the one who, I'll give him a shout out, Mosiki Scales. He gave me the name Chef B. And so I wanted the B to actually stand for something, a mantra that I live my life by. And it stands for be empowered, energized, and engaged.
Absolutely.
And I really believe that I embody that, in everything that I do. It's a presence. It's a being present with what's going on. It's knowing that you can control your outcomes, the empower, the excitedness. I'm very excited about all of the different things that I do. And the engaged is really giving back to the community. And
I love it.
Be empowered, energized, and engaged. Yeah. So
I absolutely love it.
That's Chef BEEE. That's it in a nutshell.
I absolutely, absolutely love it. Really quickly, thank you so much for sharing that with us, Natasha. I really love this. I think this story is so inspiring and it hits home for a lot of people. How and you guys tell us in the comments how many of you, your mothers, your wives, your caregivers, and or you're someone's father, you're their brother, you're their uncle, right? Mm-hmm. And you've gone through some kind of battle where there is a wake-up call that says, I gotta do something about my health. Right. And I think if you're alive long enough, none of us is born like absolutely well and wanting to stay that way like forever. We typically morph into that. Right. Yeah. Or there's something around us, even as a young child, if we choose to do that, there's something around us that makes us want to say, I got to be healthy because my mom is not, or because my brother is not, or because my uncle isn't. Yeah. Right. Something around us inspires us to want to be healthy and be well. And typically, when we think of these things, we think of my doctor should guide me. My nurse should guide me. Mm-hmm. My physical therapist should guide me, right? Yes. There's my chiropractor should guide me. But there are a ton of other helpers, healers, and amazing professionals out there that are actually stepping up to the plate even now that can actually help you. And in saying so, some of them are even more specialized, right, in what they do and pointed in what they do so that they can specifically help you with something that's going on. So we're going to talk a little bit about these roles today because Chef BEEE is one of those people that has several of those roles, right? So we're going to talk about those. We're going to talk about those roles tonight. So before we do though, I'm going to read the comments really quick. Tamika Rochelle says, greetings, Angela Cudger. Greetings, Chef BEEE. Hey, Tamika Rochelle. We want to talk about womb wellness if you're still watching with us. So connect with me and let's make that happen. Yvette July says, hello, queens. Who else was on here? We the Strong is like, hey, everybody. Hey, goddesses. Hey, you guys. So thanks for joining us. If you have not already yet, make sure that you share this out. Somebody somewhere is still trying to book an appointment with their doctor who's overwhelmed or whose clinic is closed at the moment or who's not able to actually be able to see as many patients or in an effective manner as he or she would want to. And they are looking for an alternative, someone to go to. We're going to talk about who those alternatives are and why you should have a health squad.
Yes, the
You should have,
squatty.
you should have some squad goals, man. And I don't
Squad
just mean the
goals.
squad that you're kicking it with and having a glass of wine with and things like that. No, 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 no. There is a squad that you create in your life that creates longevity for you and for your legacy, for the well-being of your legacy. And if you have no idea, other than a doctor or a nurse, which they are amazing, but there's tons of other people who can help you in a much, much greater capacity.
Yes,
Just being honest about that. So we want to kind of shine some light on these roles tonight. So Natasha,
yes,
I want you to tell us a little bit about the role that you've begun to embody as a chef, and as a holistic health coach, and as a liaison or a bridge between those who need Western medicine and those who are looking for holistic living, right? So let's talk a little bit about those different roles, why you do each of those, and how you actually go about deciding if someone comes to you. How do you know if they need you as their plant-based chef for transitioning? Or how do you know if they need you as their holistic health coach to be on a program to get some better habits underway?
yes. Oh, thank you. This is perfect. This is perfect. And so let's go back a sec. So one of the wonderful things that has happened as a result of being a part of Legacy is I now have a thriving, budding practice as a holistic health coach at a physician's office. Okay. I'm really excited about that, right? Yes. And so she is a functional physician. So for those of you who don't know what that means, she's been trained. She went to medical school like everyone else. She's taken her boards. She can prescribe medication, but her approach is not to medicate people right off the bat. Her approach is lifestyle medicine. So because I'm under her tutelage now, I actually brand myself as a lifestyle medicine holistic health coach.
Yeah.
And really, when we say lifestyle medicine, what we're saying is we want to prevent, treat, or even reverse chronic diseases that come to us at the clinic by way of changing our lifestyle, these different pillars of lifestyle. So sleep, movement, food or nutrition, relationships, spirituality, all of the things that you will learn in Legacy. All right. So it's right in alignment with what I studied, and to now branch off into a space and work right underneath a doctor who believes in that. That's her vision. She's not trying to give you blood pressure medication right away. She's like, okay, you need to change what you're eating. You need to manage your stress. We need to do these shifts before we get there. And if we can't figure it out by you changing lifestyle, then we're going to have to prescribe something.
Yep.
All right. So I'm glad you asked that about, well, okay, how do I decipher? So for me, because I do meal prep for people, I have a business called Essential Meals to Go. It's a plant-based meal prep business where I'm providing very clean meals to people who want to, they're on the go, they're entrepreneurs, they're family members. They really want to eat better. They want to eat plant-based, but they may be a little intimidated by that process, that transition. They might be bored by what they're making. They just don't have the time because of their lifestyle. I love being in the kitchen. I love that process. I'm inspired by it. And so I said, I'll do it for you. Okay, so that's first and foremost. Now, even as a chef doing that work, my goal is never to work with someone long term. Because ultimately, going back to the B in my name, it's about being empowered. And so for me, I can take on that role for a while. But for people who I know really, like if you're overweight, you've come to us because you have hyperlipidemia, you've come to us because you have blood pressure issues, hypertension, or diabetes. We see a lot of people with diabetes. We see a lot of people who have allergies, things of that nature. You really don't need to be eating out. You need to be making your own food. And so we can kind of start there. We can start there where I'm serving as a role to support you with meals. But then based on our conversations, based on what you're telling me that you want and what I know you need from what the conversations we have with the physician, then I really kind of have that conversation with the client about moving into a health coaching program.
Yeah.
Because in my program, what we're going to do is we're going to actually have cooking classes together. I'm going to be supporting you with the plant-based transition piece because that's my area. That's what I do. All right. And so my goal over those 6 months is to get you back, get you inspired to be in the kitchen again,
Yeah.
so you can create the meals that you need for longevity and to really address whatever health challenge you're dealing with. So if you have hyperlipidemia, for those of you who don't know what that is, that's high cholesterol. You don't need to be eating out. You don't need to be eating out because you don't know what people are doing to their food. All
No
right?
good, no good can come of it, right?
No good can come of it. But if you're empowered now to, prepare meals that are low in oil, that don't have a lot of oil, that are really going to help you to just thrive, man, how exciting is that after a 6 month period or longer, if we're working together 6 months or longer, you're like, man, I've started here where I didn't really want to cook. And now I'm so inspired, you know, I'm in the kitchen, I'm making food for myself. And recently I actually had a client like that. We started in the capacity of me preparing meals for her and just, listening to her. I listened to what she really wanted. And I said, man, I really think that, we should do the coaching program.
Yeah.
Because I think that at the end of this, if you're in the kitchen and you're cooking more for yourself and you're excited about it, I did my job. I did my job. So it's listening and understanding what people need and what they want. And then also just being at the doctor's office, the reality is the doctor can't do everything. The doctor can prescribe to you, you need to go work out, you need to eat better, you need to do this, you need to do that. But ultimately, beyond that, she has to kind of turn it over to someone like myself and say, look, you need to reach out to Chef BEEE. You need to, work with someone who's going to support you in getting there.
Yeah.
Because I don't have the time to get you there. I got like 100 patients. Right? And so that's really where the team piece comes into play. All right. I actually have a client right now who was diagnosed with cancer. And she also chose to approach her diagnosis from a holistic standpoint. So she's opted out of chemotherapy and radiation therapy and all of these things. And she's opted into, like IV treatments and being clean and these sorts of things. You can address a cancer diagnosis. It just depends, right? On
totally
when that diagnosis happens. If you're far along in there, that's not always the best way to go.
Nope. And we're going to talk a little bit about that too. So you're right. I love the fact that one of the things one of the students used to always say was that your diagnosis from a doctor or someone is just a suggestion, right? It is up to you to choose that this is what is wrong with me and allow it to inhabit it. We're not going to get into all of that, the energetic and the metaphysical parts concerning that, right? That's a conversation for a whole
nother one.
Night. So we won't even get into that. But what I want people to understand is that I love what we teach and what we do at Legacy, because a lot of the health coaching schools out there, I love what they do and I love what they're giving, but it is not enough to continue to teach a sustainable, holistic lifestyle. And when I say holistic, I don't just mean salad and water. I don't just mean teaching you how to eat more fruits and veggies. I mean teaching you how to understand anatomy and physiology, because that's what you're changing in someone's body. I mean teaching you how to understand the metaphysical principles that govern someone's health and their wellness and the things that they are prone to. That makes a holistic health coach, right? How can you go to a health coach who has no idea what's going on with diabetes or the systems that PCOS affects? How can they help you with the cleanse or with anything if they don't know these things? And so you'll start to see this industry, the medical field, is meshing with holistic health and wellness. So you've got a lot of doctors looking for health coaches, but they need health coaches who are relevant, who actually know what they're doing and know what they're talking about, so that they can be that bridge between Western medicine and holistic, sustainable holistic living. And so this is a beautiful thing, because I will tell you, as someone who came from a med surg background, right, being a registered respiratory therapist and then moving into being an anesthetist or an anesthesiologist assistant, one of the things that I learned was that we went through a medical school program. It was fast tracked, right? Yeah. And so when we went through that program, I can tell you there is no nutrition taught. Nope. There is no sustainable lifestyle change taught. So when you come to a medical profession, all we are there to do is prescribe and treat. Mm-hmm. Whatever you say your issue is, that's what we're there to do. We ain't there to help you get off the couch. We're not there to help you do anything other than take this chemotherapy and let's see how it goes for you. That's all we're there to do. And that's all we're trained to do. So to go to your doctor or to go to your nurse or your nurse practitioner and say, you guys didn't help me. Well, that's like taking your bike to a car shop, right? And saying, can somebody help me change the chain on my bike? Somebody might be able to, but it's just not what they do there. Yeah. So I think there has to be some education and some perspective around what do these different people do and who needs to be my squad, because you do need your doctor, but you also need your health coach, right? You do need your health coach, but you also need a plant-based chef that you can reach out to, right? Because there's some pieces and parts to your life that you may or may not be the greatest at. Like somebody just said in the comments, she says, I love to cook. I just feel like I don't have the time. Yeah. You need to have access to a plant-based chef who can make your food. Exactly. And you have to know what their roles are. You have to know the different roles of people and say, these are the folks I need on my squad, right? Whether you're building a business or a better body, you need a squad. And you need to know what your squad should know before you hire them, right? So let's run to the comments really, really quickly. Yes. All right. So we got Tracy Thomas watching with us. Amanda says, hello, lovely. You have an amazing, loving, motherly energy, she says, Natasha. Congratulations. Oh, thank you. Jillian says she loves what we're talking about. It's all inclusive. Rita says, yes, she loves that lifestyle management, right? Yeah. Amanda says, loves it. Valine says she loves this and she needs help transitioning to eating more plant-based. Tracy Thomas says Dr. Bruley shares gems. Thank you. Thank you so much for being with us. Jillian says kitchen inspiration. Yes. Amanda, Valine says, like she says, she loves to cook, but she doesn't have the time. Thank you for joining us, Jessica Gordon. We have a bunch of people with us. Nisha, Raquel Wells. Hey, you guys. Thanks for So you want to make sure that you are keyed into what health professionals do, right? So I have been in the medical field now for almost 2 decades, right? Last time I actually dealt with patients was in 2016. Launched Legacy in 2018, became a full-time entrepreneur in 2016, and been rocking it out ever since then. I have more than enough knowledge on both sides of the fence to tell you, you don't need to be over there talking to them trying to get an appointment. You need to be trying to find yourself a health coach. Oh, yeah. Right? That book, no more appointments to do any of that stuff. You need to be talking to the people who know what to help you. Now, here's what I want you to try to bring into perspective, and we're going to talk about this now, is how do you know when you need one or the other? When you're looking at things where you need more time, more effective, and more specific results, you're probably not looking at your doctor. Right. I'm going to say that again. When you need more time, personalized time devoted to you, to help you fix, cure, change, treat, sustainably fix, or whatever, more time, more specifics, more pointed treatment, you're probably not looking at your doctor, because they are overwhelmed with people who have little problems and some have big problems. Yeah. But the point is they are overwhelmed right now. They've been overwhelmed, okay? And so if you're looking for something a little bit more in depth, then you're looking at a health coach. So
and I'll say something. Let me say this, Angela. I also think most people need a health coach or some kind of coaching. All right, most of us do, because I was actually having a conversation with someone about this today. Most of us want to be nurtured. Most of us want someone to check in on us, to hold us accountable. Now, the coaching piece of it can look different. It could be one-on-one. Some people want that exchange where it's all about me. And then there are others who don't need all of that attention because they're sort of self-starters, but they like community. And so the group coaching piece works for them. But I do think that, you know, I kind of want to go back to the doctor's office that I'm in. The beautiful thing about that concept and the way things are structured there is, you know, I signed my, you know, non-disclosure agreements and all of that. So before I meet with a client, I can ask, well, what was their blood pressure when you last saw them? What was their A1C when you last saw them? What kinds of things did y'all have a conversation about that we need to really focus on in our health coaching sessions? All right. What treatments are they going to be having soon downstairs in the wellness suite? And, you know, it's almost like I'm helping them to be accountable to the doctor, you know, in regards to things that they were asked to do to be better, to work on. Sometimes people go to a physician and they just don't have the time. They may not just be overwhelmed and they just don't get it done.
Yeah.
And so now the health coach can step in. These other people, you know, your health coach, whether it's your, you know, your trainer, whatever it is, you can now step in and just ensure that you're getting all of the different things that you actually need to be successful, because the doctor is not going to do that. The next time you're going to hear from the doctor is like maybe a couple days before your appointment as a reminder.
Yeah.
You need someone working with you, maybe if it's every week, every other week, checking in, making sure that you're drinking your water, making sure that you're moving, making sure that you're staying away from those sweets. We all need someone that's looking out for us.
Yeah.
Okay. And so I really wanted to say that because that's one of the beautiful things about this relationship. There are these different folks that's at Robin's Health Alliance where there's the physician, but then if someone's doing detoxification therapy because they got to flush out their lymphatic system, again, they might have a cancer diagnosis, they need massage therapy, they need chiropractic services, they need holistic health coaching from me, they need to work on their meals. You're getting a one-stop shop in that space. It's not many places like it.
Nope.
It's not. It's the model. It's the model.
Yeah.
I'm grateful because I found someone who's in alignment with the way I was taught and how I view how medicine should be. It's a team effort. It's that squad effort that we're talking about. It's not just one person that I'm talking to. It's multiple people that supporting me on the journey.
Yeah.
That's what we all need. Okay.
Yeah. I agree.
I just wanted to say that.
Yeah, no, I think that's amazing. That's exactly what it's about. I like how you said, you know, you're only going to get these notifications or see your doctor or hear from them right when you're getting ready to do your appointment, or, hey, everything looks good, go ahead about your business, we'll catch you next time. Yeah. But what happens in that dash, right? That date, your birth date, there's a dash, right? All that time that's happening between that dash is on you.
Yeah.
So you have to decide who's on my team and where are they leading me to for the longevity of my legacy, right? All of the different, so it's not, your body is not a drop off. Let me say that again. Your physical body is not a drop off. You can't just take it to the doctor once a year and just let them say, okay, it's time to change your carburetor, or okay, it's time to, well, your body doesn't work that way. Between that time, you have to actively do things to keep yourself healthy and to keep yourself well. And those things are made simpler and less challenging when you have a squad.
Oh, yeah.
Those things are made simpler and less challenging when you have a squad and you know you got somebody you can call on. Okay, I got a chef I can call on. I got a personal trainer I can reach out to. I have an IV hydration therapist that I can reach out to. A whole squad popping over here. And that's what keeps this thing up and going.
Oh, my goodness.
So when you look and you see, it ain't somebody blessed with curves and great hair. No, it's a squad taking care of me. Right. And I don't need them all the time, but when I need them, I need them.
Get them. That's right. Let me say this too. The squad is also the people that you have in your circle. That's your peoples, your crew. All right. Your crew. So, for example, one of my girls, we doing a yoga challenge right now. And she didn't tell me to do this, but I'm sending her pictures of myself doing the yoga. Boom, day 1 done, day 2 done, and I'm shooting it to her. Why? That's keeping me motivated. That's keeping her motivated. She's sending me pictures of her meditating. All right. So it's also like-minded people. It's those relationships that we were talking about in sort of the wellness paradigm, right? Mm-hmm. Our legacy wheel. It's your relationships too. Who are the people who got your back outside of the wellness workers? Who are the people who are reminding you to eat well because they're eating well? They don't have to tell you to eat well. They're eating well. So you're like, wait a minute, maybe I should eat well. They're drinking water. So you're drinking water, right? They staying away from the things that aren't serving them well. So you're kind of like, I'm not going to do those things. They don't serve me well. So our relationships are really telling on, one, how we can be and how better we can be. So if we're around folks who are not pushing us to elevate ourselves and to be high vibrational, then it's like, what you doing? I don't want to be around the folks that I was around 10, 15 years ago, hanging out, not doing it, saying I'm bored, not really elevating themselves, not trying to do something better. Why do I want to be around those people now? I want people who are going to help me to be the best that I can be.
Yeah.
Sound mind, spirit, body, everything.
Yeah.
And so that's part of the squad too. That's part of the squad too.
Yeah. Yeah. Squad has to do with the people and their ways, right? And like we always teach in legacy, they can't just tell you they're doing it. You need to be looking for the evidence.
I want evidence
that they're actually doing it. So if I say, Natasha, I work out, I go to the gym, and Tasha's like, okay, well, let's run the track real quick. And I'm out of breath. I can't do 5 push-ups straight. Tasha's gonna be like, somebody lying. Somebody lying. Like, I ain't saying you lying, but somebody lied, So we gotta make sure that in this accountability piece that there is evidence. And then let me tell you, if you're on somebody's squad or if somebody's trusting you to be accountable and be truthful to them and you see them slacking, like if somebody sees me gaining 20, 30, 40 pounds and they don't pull me to the side and say, yo, you fine, but it's getting out of line. It's getting out of hand. It's getting out of hand, honey. So let's do this. Let's do this. I'm gonna do a juice cleanse, and I love for you to do it with me. And then squad, I think the way that we show love, there's a way we show accountability, and there's a way that we trust and hold each other up without judgment. Exactly. And so that's a huge part of this. So anytime you've got somebody on your squad, I don't care if it's your doctor or your nurse or whoever, their practitioner, anytime you explain to them, this is where I'm trying to go with my life. If they say, don't do all that. I had a doctor one time say, I was having a conversation and I was like, people need to be more accountable for their health and they need to try to transition to more plant-based so that they can be healthy. He said, no, they don't. They just need to take their medicine.
What?
Listen, anytime you hear something like that, you need to switch sides.
You need to go.
You need to start seeing other people, right? It's time to start hanging around with some people, right? Crazy. And don't be afraid to release all types of relationships. Even if you had history, here's what you say. You know what? I like how you've taken care of me as my doctor these years. Do you have a referral of someone who can do that? So there's a way that you can ask for these things and get what you need to get the team that you need, because energetically, even if you don't leave, someone in alignment with what you're going to do is going to be introduced to you anyway.
You need to have someone, like particularly that relationship. If you're one of those people that goes to a doctor every year, it needs to be someone, and I would argue that it's all of the people on the squad for your well-being, all the people that you bring into your circle to help you elevate. They need to be in alignment with how you view all of these things. If they're not in alignment, it's like, what are we doing? If they're trying to prescribe you medication like you're talking, and you're like, I'm really not trying to do that, y'all always going to be combating each other. All right. But if you have a physician that is not judging you, you go into the doctor. Now, let me say this. Let me pause and say this. There's some folks who will cancel their appointments because they know that they haven't met their goal. Their doctor's like, okay, you need to lose X number of pounds by the next time I see you, but you have no guidance on how to do that. And so when that next appointment comes up, you're canceling the appointment because you know you didn't do what you were supposed to do. But you were kind of left out there to kind of figure it out by yourself.
Yeah.
And that's not cool either.
Nope.
So you need to have someone, a doctor, whomever, on your squad that's going to say, okay, I can't do that for you, but here's the person. Let's refer it out. Go see Chef BEEE. That's what happens at the doctor's office. You need to shift how you're eating. We need to get you eating more plant-based foods. You know what? Here's her card, Chef BEEE. But guess what? Most of those people don't call me. What I do is I get the number and I call them.
Yeah.
Oh, Chef BEEE, the doctor told me that I need to get in touch with you. Yep. Let's do it. Let's talk. What's up?
See,
so
this
I'm not waiting for them. I'm taking action and I'm reaching out to them because they're nervous. They're scared. They don't know what to do.
This is the brilliance, and I like somebody put that word shift, right? This is the brilliance of having connections, whether they're in business or in life. Because even if you don't or being aligned with those true connections that can get you what you need. Because even if you don't get a chance to reach out to them, that connection will call you up and say, let's squad up.
Come on, let's do this.
And even if it's a not now, I'm on your squad. Like, let you know you have access to a health coach, right? You have access to someone who is rooting for you to do better, right? And so that's really what we need. So we want to make sure that when we're looking at this, and real quickly, if you're in Legacy, if you're on here, you're a health coach, you're a healthcare provider, you're a nurse, you're a doctor, you're a trainer, whatever you are, shout out in the comments what your profession is, right? Let us know who you are. And obviously, if you're in Legacy, let us know what cohort you're in. So we want people to know who you are because everyone on this live stream is looking for somebody to put on their squad.
They are.
If your squad is complete. If your squad is complete, then you're good to go. But if it's not, you need a squad.
Come on. Let me say this too. The other thing that I found, Angela, is that people, even in this role, right, being at a physician's office and working with patients and things of that nature, not everyone trusts me right away. They hear good things, you know, Chef BEEE, blah, blah, blah. But I'm grateful that I do other things. So I have meal prep. I do sweat events. I have different holistic events around the city so that if someone isn't willing to commit just yet to a 6-month program with me, they have other ways that we can engage so that we can build some trust. All right. I'm just thinking about one person who I've been, you know, encouraged to work with her, but she's just not ready yet. She's just not ready yet. But I've had different events and she's come out to those events.
Yeah.
Right. I'm doing a cleanse in a couple of weeks. She's participating in the cleanse.
Yeah.
And so that's going to give her opportunity to build trust with me. Yeah. And so, you know, and it's not just about doing one thing. It's about being able to offer some other experiences for people to connect with you and align with you and really see if it's a good fit. And as they have those experiences with you, they'll see, okay, man, I really like the way this person's flowing. I like the way they're talking. I like how they're living their life. And this is what I see for myself too. And I think I want to go on that journey with them.
Yeah.
And so, yeah, you know, it's a blessing, you know. It is not something that I take for granted being in the role that I'm in because, you know, some people have diagnoses and it's very scary. And so there's always a place of coming from non-judgment you need to have, but love and compassion, checking on people. And this is something that I naturally do anyway, because I like people. I like to nurture people. And so this is definitely a space that I'm in. And I'm so grateful to be in this role as a holistic health coach and a chef, because, you know, I take pride in the food that I'm preparing for people. I want you to feel the love. I want you to feel the just know that the food is healing you. I pray over that food, y'all. I pray over that food. And so if you don't have folks who are looking after you in that way, it's like, what you doing?
Yep.
What you doing?
Yeah.
Your body's got to be looking and rooting for you like that. They want you to be the best you can be. Period.
Yep. Yep. Your squad's got to be there for you. They got to be there for you. I remember, and I keep a lot of people on squad. Like if you don't know, like a lot of people don't see the back of legacy. And Natasha, Chef BEE is one of those people that gets to. But you know, there's enrollment team. There is an adjunct faculty team. We have a marketing team. We have administrators. And so, in order to keep all of these balls juggling, I gotta have a squad of folks taking care of me. So you better know my doctor's on speed dial, right? And coming from anesthesiology, I got the best folks on speed dial, right? No matter what it is, if somebody needs surgery, I got good folks on speed dial. Holistic people, iridologists, and then I remember needing IV hydration therapy, and I was talking to someone who typically holds space for me in the spiritual space. And I was like, I think I probably need some therapy. I need a boost. I need something. I go to the gym every day. I said, I think I'm getting run down. She's like, yeah, go get, she said, yeah, you need hydration therapy. And I said, okay, it's a spot right by my house. She said, let me tell you, let's check this out. I said, it's a spot right by my house. She said, what? Oh no. She said, no, no, this is a squad. Only certain people get to touch Dr. Kudger. I'm sending you directly to this is, and this person took such great care of me. So I showed up with my laptop and all this other stuff. She was like, no, this is self-care time, doctor. You need to close the laptop. Oh, wow. I will put on healing high vibrational music for you. That's why you were sent here. And so if your squad don't have you like that,
right,
you're looking crazy. You're looking crazy. So you have to so it's not just about that person and their readiness, whether or not to work with you. It's about having the access to insight.
Oh yeah.
It's about having access to somebody who's got you and got your back. You know who those people are. You want to connect with those people. Even if you're not ready to work with them right now, squad up. Get to know people and know what's going on. Whether it's a mental health person like Sandy Bird, a master herbalist like Rachel Newsom, plant-based chef like Chef BEEE, get some people on your side. Get to know some folks, right? Because I guarantee you, the day that you need them, the last thing you want to do is Google your way to good health. That ain't ever gonna work. That don't work.
Yes.
I can tell you now that doesn't work.
Oh my gosh. And you know, here's the thing too. It's about nurturing. And so once again, people take time before they're ready. And so that's why it's so important to give people ongoing education about what it is that you do. Show them that you do have expertise in the area that you are operating. And then also creating your digital footprint so that they can see you. It's not like, you know, if I think about holistic health coaching, oh, Dr. Kudger. If someone's thinking about plant-based chefs, I need a meal. Oh, Chef BEEE. So you want to make sure that you're out there enough so that people can get to know you in different ways and hear from you and hear your expertise so that when it's time for them to take action, they know, okay, this is the person that I want to be. I want to be in their squad. I want them to help me to get to the next level with what it is that I'm doing.
Yeah.
So.
Yeah. Yeah, exactly. And then I can tell you, even if a person says, well, I can't take you today, but because you were referred to me, I got somebody just as good. And we've done this before too. It's like she said, well, I'm already committed to someone else whose squad I'm on that day. So let me get you somebody else who's just great. And it never fails. Like, this is the access you want. So you want to be clear about what the roles of what people actually do. Okay. So let's run to the, she said, never Google your way to good health ever.
I love that. I love that.
Ever. That ain't gonna work. Right. Don't Google or YouTube your way to good health. You need somebody you can pick up the phone, reach out and touch.
Right.
That's what you want. And you want to know that they know their role. Right. So if they are a holistic doctor, they can give you more insight on holistic living. Even if they don't have time for you, they have access to a health coach, a well-trained health coach, right? So you want people to be able to do that for you. So let's run to the comments really, really quickly. People, you guys are like dropping these comments in here quick.
Oh, yeah, let's hear them.
Ashura Madia, I like that name. She says, thanks for this inspiring information. You are absolutely welcome. Tracy says, love and compassion for other people. Raquel says, I love that you pray over the food for healing. It is so powerful.
You got to. Let me say this. So I wrote a cookbook, right? Let Plants Nourish You. And after each of the recipes, there's one there's one ingredient that's at the end of every recipe. It's called a pill. And so people who've purchased the book, because they don't read the introduction, y'all, they'll ask, what does pill mean? Y'all know what it means? Patience, intention, light, and love. And those are the 4 things that I put in my food, and everyone should. This energy, it's the energy that we put into the creation. You ever think about people who cook for you like that one? That's nasty. It tastes bad. They might have been upset. They might have had an off day. You don't want nobody doing that for your medicine. Your food is your medicine, right? It's information, right? That's what we learn. And so for you to have someone who's putting patience, intentions, light, and love into your food, they taking their time. Take my time. That's powerful. Powerful. I mean, I had somebody eat the food and they said, I feel healed. I was like, wow, that's incredible. And so, yeah, it should be like that. Like it's serious like that. You want people who are taking what they're doing very seriously. Period. They have integrity with what they're doing and how they come to serve you. Period.
Yeah.
Because that's going to help you to just be better. That's going to help you to be the best you can be. When they come with integrity with whatever it is that they're offering you and supporting you.
Yeah, exactly. So really quickly, they said Let Plants Nourish You by Natasha Bruley. You guys, we're going to get you the link for that book. It's going to be under this live stream in the Legacy in the Tribe group. And then if you could go to the school page, the Institute page, and under the same live stream, if you put the link to that book, that would be very, very helpful. So Let Plants Nourish You is the book that she's talking about. And it specifically is probably the only one on the market that infuses essential oils, essential oils into the food. So now you know that there's patience, intention, love, and light actually infused in that as well. Right? So we got to make sure you do that. Shawana says, wow. She says, so even be careful of people that cook your food. Absolutely. Because it's energy. Wow. Never even thought about something like that. That's one of the reasons I don't eat out a lot.
I don't eat out almost, look, since this whole COVID thing, girl, I'll be eating from people. I don't know what they're doing.
We're good. I'm about this bag of snap peas. I'm gonna get these dried beans, going to rock out this rice over here. No.
I'm washing my hands constantly. I'm like, y'all get out my kitchen. No. I'm cooking for these people. All right. And so yes, it's energy, because think about it also. When you have people who are not using the best quality ingredients to prepare your meals, all right, they're skimping. They're not using organic foods. They're using soy. They're using GMO products. All right, all of those things, that's information in your body. That is helping you to lower your vibration when you're eating those things. All right. So ideally, y'all, the best situation is for you to cook your own food. All right. If you ain't gonna cook your food, you need to have Chef BEEE cook it. There you go.
Exactly. and that's the God's honest truth. What you will not do, somebody else will. And somebody else will be glad to do that because it's their calling and it's what they love to do.
That's right.
I'm not gonna go change my oil like ever. Somebody somewhere loves to do that, and I want to let them love to do that while I love to teach and create and train and help. Right? I'm doing what I love, and that leaves more time for me to do what I love and for them to do what they love. Okay, it should be infused in every area of your life, not just on your job or in your relationships, but it should be in every area of your life, especially when you are talking about your physical body and keeping your physical body healthy. Tracy says, so true, high vibrating food. Now, here's what I want to say to that, though, because there's a gazillion cookbooks on the market, but here's what I want to talk about. When we're looking at how a person puts together meals, how different, and I want you guys to tell me this in the comments, it's not a rhetorical question, I really want you to answer it. How different is it to have someone give you a recipe like Betty Crocker, right? Who you've seen their things in the store and things like that. That is a well-known brand with all a bunch of stuff in it. You don't really know what's in it, but you know what's in the recipe, what the recipe calls for. Versus someone who has been trained at the Living Foods Institute, who currently grows her own food,
Mm-hmm.
who currently has a plant-based meal service, and who knows holistic health coaching. How
Yep.
much better for you is it to get a recipe from that person or guidance on what you're eating from that
Yeah.
person and how to put your food together versus someone that might be mainstream and popular, but you have no clue who they are?
Yep.
This is what we're talking about when we're talking about knowing who's on your squad.
That's right. Yeah.
That is so important. So when you think about this and you say, well, it's just another cookbook. No, it ain't.
No, it's not.
There is a walking, it comes from a walking wealth of knowledge in the
Mm-hmm.
holistic health and wellness space. That's a different kind of book on your shelf.
That's right.
It's a different kind of thing.
And I'll say this too, you know, in thinking about the people who I knew would consume or use this book, you know, I'm thinking about, okay, well, I don't want them to have sugar. So let me think of alternative sweeteners that are not going to raise their glycemic index, that are rather that's going to raise their blood sugar levels. Let me think of some other alternative oils that are, you know, live, that are not heated. Let me think of ways that you can eat nuts that are going to be sprouted. And so I'm always thinking about all of the things that I've learned and how I can infuse that in a cookbook so that whoever's experiencing that experience, they're going to be left better than when they first started looking at that book. They're like, man, this is well done. This was, you put a lot of thought in this process of putting this book together.
It's
really appreciated, you know? So
holistic. That is what holistic is. It takes into accountability all of those things, right? Now you can choose whoever you want to be on your squad, or you can be the person who educates yourself through comprehensive programs and start your own squad.
That's
but
right.
what you cannot do is sell tea and say you in the health and wellness field. This time out for that. We don't do that kind of foolishness. It's like, oh no, you're not a health coach. You're someone who sells tea. Let's call it how it is, right? There's nothing wrong with selling tea if tea is your passion, but don't call yourself something that you're not.
Yeah.
So you want to be careful about the credentials that people have when they say they're on the squad. You wouldn't go to a doctor, or you wouldn't go to someone who says, well, I'm like a doctor, but I didn't go to a medical school. Well, I'm sorry, you're not like going to be working on me, right? You're not going to be pretending to work on me because I don't have a pretend body, right? So I want to know that you have a comprehensive education and you know what you're talking about, right? If that's not the case, then you refer me to someone who does, if that someone is even on your squad. So you want to make sure you're connecting with people that where it makes sense. Sandy says, how can I get you on my squad, Dr. Chef BEE, not being ATL? Oh, honey.
Man, look, Sandy, we working on it. Okay, we working on it. We trying to get those meals out to you if you're not in metropolitan Atlanta area. So please stay tuned for that. If you're not on the Essentially Chef BEE page, check that out. But stay connected, because we are working diligently on having the opportunity to expand so that we can bring those meals to you guys outside of Atlanta. And, you know, the other thing I wanted to say is I call myself a holistic health coach. All right. Some people try to put you in the category as a nutritionist or a dietitian. No, I'm very clear what my lane is. Dietitians have gone to school to study dietetics. All right. I am not a dietitian. I am a holistic health coach. I'm a guide. I'm supporting you on your journey. And yes, I can make some recommendations, but ultimately also what I do, if I'm working with my physician, I'm basically checking back in to make sure that the things that you were at, that the physician asked me to do, that I carry it out. Okay. Yeah. And I'm not prescribing them anything.
Yeah.
I have to be very clear. Holistic health coaches, we don't prescribe anything. Oh, you need to take X number of milligrams of this blood pressure medication or this medication for cholesterol. We just work with you. You make the decisions on what you want, and then we figure out the process of you getting to your goals, your SMART goals that you've come up with. Yeah. And so you gotta make sure that you stay in your lane in terms of, one, what you've been trained to do, so that you don't, you know, step on anyone's toes. I'll give you a little story real fast. There's a woman that came to my doctor's office. The doctor suggested that I talk to this person. And we hadn't started a relationship in terms of holistic health coaching or any of those things. But I don't even remember having a deep conversation with this person. The doctor told her that she needed to be on low carb foods. And she told the doctor, well, Chef BEEE said that I need to be on high carb foods. And I'm like, I did? I could never have said that. I didn't give any recommendations to that person because we didn't even have our relationship go beyond a certain point.
Yeah.
And so, of course, the doctor checked in. Hey, I just want to make sure we're on the same page. And I'm like, oh, yeah, we are totally on the same page. I was like, who's this person again?
Yeah.
And that happens a lot. So I found out later that doctors experience that a lot and people experience that a lot. You tell folks, hey, check in with your doctor.
Yeah.
X, Y, and Z. They're doing their own thing. And then they pass it on that you said, oh, no, you told me to do this.
Yeah.
And so I've been learning that even the doctor experiences that too.
Yeah.
So it's so important, one, in this space that we document everything.
Yeah.
And that we stay in our lane. You are not there to prescribe. You are there to guide and support people on their journey, whatever that journey is that they've decided they want to be embarked on.
Yeah.
Okay? So we got to be clear about that.
Yeah, I agree. I totally agree. Really quick, we're gonna run to the comments before we hop off. You guys are hanging in here. Jeez. Okay, so Wita says, Tracy says, check out Chef BEE's YouTube channel. It is amazing. Wita says, oh my God, I was talking to my sister about this last night. So many people calling themselves health coaches selling tea. So that's on you to put somebody on your squad to think. And so first of all, it's on you to think that a tea is going to help you fix anything. Mm-hmm. There's never going to be a one thing that fixes you. It more than likely is going to take some type of holistic approach, meaning meals, movement, motivation, maintenance, a combination of these things to get you back to where you need to be. One thing ain't gonna ever get you there.
Never.
So that's the first thing you got to be thinking about. So anybody that's on your squad telling you only one thing, it's time for y'all to see other people. And then when you build a great squad, you pay it forward and introduce them to the real investment, right? So you be good about it, be nice about it, right? And then Tracy says, Ashe, Raquel tagged your essentially Chef BEEE page here. Yolanda says she loved the first cookbook. Got a part 2 in the making? Yes or no?
Yes, part 2 is coming. Well, actually, just so y'all know, there's Let Plants Nourish You, and we actually have 2 ebooks. So I do these cleanses pretty often. So if you actually go on my page, chefbee.com, you'll see it's a Spring into the Raw cleanse. It's a 10-day, 30 recipes seasonal cleanse. So let me say this before I add that. It's so important that the people that you have on your squad, they're constantly getting better from an educational standpoint.
Yes.
All right. They need to be, as we say in grad school, getting smart. All right. Get smart. If they're not reading, if they're not studying, if they're not elevating themselves intellectually, then they're talking about the same old thing. Right. So you want to make sure that you have folks on the team that's constantly improving their knowledge so that whatever they're sharing with you, you see the evolution. We talk about essential oils, we talk about plant-based foods, but that paradigm is shifting constantly. Mm-hmm. So for my tribe members, I got to show them all of the different things that I'm learning, and I want to because it's so exciting. I want to share that with them. All right. And so the evolution, your growth, you want people on the team that you can see growth in. Angela is so different than when I met her however many years ago.
Oh my God.
Really changing, right? So we want to make sure that we're looking for these clues as we bring people on the squad to support us. Are they growing? Are they ascending? Are they taking care of themselves? Mm-hmm. Is there evidence of that? If not, it's like, what are we doing?
Yep. Yeah. And that's where that accountability piece comes in. You have to tell them too, hey, have you checked out this? Or I'm checking out this, and share with them how you're growing too, right? So one of the things I love that you said about that is that like your education is everything, right? We are always either progressing or regressing. And so every single day, just like we have to get up and choose health and wellness, we also have to choose to elevate, transcend, and do a lot more things for not just our physical body, but our spiritual one too. It's always a choice. It's your choice to go to a program, and it's your choice in which one you choose.
Oh, yeah.
You need to know where you want to land with your health and wellness. And I can tell you, when you come to Legacy, it is holistic. Like, we're not just going to say, here you go, here's the health coaching stuff. We're going to say, no. Let's deal with you too. Let's deal with your blocks too. Let's deal with your stuff too, because how are you going to energetically go and guide someone else when your stuff is all mixed up and messed up? Now it's talking about this exchange that's supposed to happen, and it might be challenging for you to make that because you're still in your own way. Right. So we talk about all those things, right? Things that other programs are not even going to dive into or touch. So when people get to this program, they're like, yeah. This is what I've been looking for. This is what I've been looking for, right? So you want to make sure that you have that going on. And so I'm gonna run to the comments really quick, you guys, and then we're gonna hop off, right? Progressing or regressing. Yes, Raquel, either moving forward or falling behind. The world is always changing. So, for example, if you still got a flip phone, you regress. The world has moved on. The world's moved on, right? Like everything in life, you have to think about this. This is one of the things I taught in the holistic business boot camp today, which went virtual, right? So one of the things that we learned today was not just about expansion and refilling that container through what we learned and the people that we are around, but we also talked about how we progress and what happens with progression. And if we're not choosing progression, how we shrink back significantly, so that by the time we try to get to where we want to go, it seems so insurmountable. Yeah. The world, every single person and thing on this planet is here to create, to grow, and to progress. Mm-hmm. If we are not choosing that every day, we are automatically regressing because the world just keeps on growing. Yeah, that's the only two choices you got every day. It's the only ones we got. So I hope that makes sense. Yes, legacy shows you will burn some boats. Who said that?
Burn some ships. Forget the boats, burn some ships. That's right. Let it go.
Mm-hmm. And she says, I had to heal and hold myself accountable. Lead by example. We have to, right? She says, lead by example. She says, I'm forever will be a student. Yeah. And she said, the world is moving forward. Always has been since the dawn of creation. It will always be moving forward. And we choose by what we read, who's on our squad, what we eat, how we act. We choose to move forward or we choose to sit still. And neither is right or wrong, but one is going to get us closer to experiencing a more fuller and fulfilled life, and the other just simply won't. And so neither one of those are wrong, but it is always a choice. Okay. Okay. So we're gonna hop off, y'all.
Yes.
So, any last words you want to give to them as we get ready to hop off?
You know, the thing that I thought about in these last moments is be the inspiration that you want to see in others. And so for me, when I choose to work out, when I choose to meditate, when I choose to drink water, when I choose to do all of these things that I know serves me well, sometimes I don't want to do them, but I do it because, one, I know it's going to benefit me. But then also I'm thinking about the next person who may not have had the courage or that inspiration to make those choices that day. And sometimes when you do that post or you share it out in a text message, hey, happy Saturday or whatever it is, it just helps that person take another step forward, because that journey that they're on is about 1,000 steps, right? And it's just about the first step so that they can keep going forward. And so I do those things, one for myself first, but then also to make sure that I'm supporting others who may just, be having a rough time getting started. Yeah. And that's really been the foundation of this work, to inspire others to be the best that they can possibly be and see that it's accessible to everybody. Eating healthy, living a good quality life, being holistic. And no one's saying here that you got to do all the right things all the time. It's just the mindfulness of it and knowing that you can always get back to it, even if you get off track a little bit. It's so important. So we just want to make sure that we're operating in that space too for inspiration. Our community needs us now more than ever. And so if you want to come and serve in this capacity as a holistic health coach or someone in the wellness field, really think about what it is you're doing and how you're living your life. And is the life that you're creating for yourself, can you lift it up? Can you put it out there and say, oh my gosh, someone would be proud for me to be their health coach. I'm doing the best that I can do to be the best that I can be. If you are, awesome. But if there's work that can be done, then we owe it to ourselves and we owe it to the people that we bring on as clients to do the work and be the best that we can be. Period.
I love it. I absolutely, absolutely love that, you guys. Listen, we're gonna get ready to hop off. She says, sending love and light to the yes, Tracy. Right? So take some time really quickly. One person on this live stream, because I'm a firm believer in the fact that we create this energetic container that allows every single one of us to be way better than we were before we jumped on this live stream. So I want you to seal in your time together with someone by sending love and light to someone in the comments. So you just choose the name of someone, whether you know that person or not. And I challenge you to choose someone that you don't know and send them immense love and light over this live stream so that we seal in our time together and our knowledge together. Your container has been made greater. Your expansion has been made better because you got on this live stream tonight. As always, it's a pleasure sharing time and space with y'all. We'll still be engaging in the comments. If you got any questions, Chef B is going to go back for those of you who want to get to know her better and make sure that she connects with you properly. You guys have an outstanding evening, everybody. Good night.
Everybody. Mwah.